But I want to show you what happened on day one of lockdown 4.0. Chaos ruled in different parts because the central government only late last evening came out with its guidelines. The states spent the large part of today to come out with their own idea of what those guidelines would mean in the states, as a result of which there was chaos, long traffic jams as if the lockdown was over, people out, some shops being opened, then shops having to shut down, migrants queuing to try and find a way back home. Here's a quick look at some of the things that happened on the first day of lockdown 4.0.
Day one of lockdown 4.0. Metros woke up without any idea of what the new deal would be. The centre released a fresh set of guidelines on Sunday evening, but allowed the states to demarcate the zones. And no state was ready with a plan on Monday morning. If there was an abundance of caution and fear of infection among people at large, on the roads there was chaos and confusion. Delhi-Noida border saw traffic snarls with long queues of vehicles. But with restrictions on intrastate movement, most were forced to go back.
20 मिनट से फंसे, दिक्कत तो होनी है, दिक्कत तो सबको ही हो रही है. क्या करोगे इसमें?
सर मैं 1-1.5 घंटे से जाम में फंसा हुआ हूँ. आगे क्या प्रॉब्लम है ये तो मुझे पता नहीं है. आगे से जाम लग रहा है.
In Delhi's Kashmiri Gate, shopkeepers were gearing up to open their shutters in expectation of a go-ahead from the state government.
बिल्कुल गाइडलाइंस का इंतज़ार है और हम यही सोच के बैठे हैं कि शायद ऑड इवन स्ट्रक्चर पे हम लोगों को अपनी मार्केट खोलने का डिसीजन मिलेगा. इसी कारण हम ये सैनिटाइजेशन करवा रहे हैं.
With over 33,000 cases, Maharashtra remains cautious, and Mumbai, the maximum city, continues to have maximum restrictions.
Mumbai is the city it is because of the film industry, because of the artists of Mumbai, the hotel, the restaurants. It's a bustling city, we all know. But all these industries are going to stay shut at least till the 31st of May is what we have been told.
West Bengal government has allowed inter-district bus services to resume and opening of all big stores from May 21 in non-containment zones.
By calling off the curfew at night and allowing shops to open even in the containment zone with different categories, this seems to be yet another chapter in the centre versus state battle, which is here to stay, and with addition of chapters, looks to get even more murkier with every passing day. However, the sufferer is the common man on ground, which seems to be clueless on what would be next now.
By afternoon, Karnataka announced it will allow bus services from Tuesday. Autos and taxis are also permitted. Barbers can open their shops and parks can open for limited time. But no permission for gyms till 31st May.
Every Sundays till the 31st of May will be a lockdown barring essential services. In fact, the Chief Minister wants businesses to thrive and for people to follow all the rules and regulations to keep themselves safe.
In 12 Tamil Nadu districts, including Chennai, there will be no change in curbs. Norms of lockdown 3.0 will be followed here. Public transport will resume in 25 districts after a break of nearly 2 months.
Everyone who's got people working for them have to ensure transportation of their staff because public transport is still inaccessible. There's no public transport, educational institutions remain shut, places of worship remain shut, hair salons, spas, gyms also remain shut in Tamil Nadu.
India is slowly opening up, but it can't afford to let its guard down. Unless social distancing and face protection is strictly adhered to, the coronavirus pandemic could go out of control. Bureau Report, India Today.
So what can you do? What should you do? How do you ensure that you and your family members stay safe in the middle of this raging pandemic at a time when restrictions are being eased? And a lot of people seem to think it's all kosher and now they can just go out and do as they please, which is absolutely not the case. For a very sharp medical perspective, I'm joined on the Newstrack tonight, first by Professor Brahma Mukherjee. She's a professor of epidemiology and the chair of biostatistics at the School of Public Health, University of Michigan. Dr. Giridhar Babu is a professor. He heads epidemiology at the Public Health Foundation of India. Professor Gautam Menon is an epidemiologist and a professor of biology at the Ashoka University. So welcome. I want to go across to Dr. Babu first. Lockdown conditions in India being eased. You've seen how in different parts of the country long traffic jams were reported. People very naturally desperate, frustrated to get their shops open, to get life back on track. But this at a time when the virus's spread is more deep than it has been so far. And India is reporting the maximum number of cases seen thus far. How, according to you, sir, should people who are watching you at this time on India Today try and keep themselves safe? The country is opening up, their cities are opening up, and yet the virus is spreading deeper. What should we all be doing, sir?
Hello, Rahul, and welcome to Gautam and the other esteemed panel, Dr. Banerjee. So my plea to all the Indians who are watching this show right now is, India has accomplished many things in this period of lockdown, which many countries have not even dreamt of. When I say this, it's not out of any patriotism, but purely based on the data. The kind of death that we have seen in India, I wouldn't go to the numbers. I have shown earlier also, just relying on absolute numbers wouldn't mean anything. In terms of the absolute number of deaths that the country has prevented, we have done the best compared to most countries in the world. However, there are challenges within the country where some areas, especially the metros, and we have reported 4 states which might be having some kind of higher burden compared to the others, which are Maharashtra, Gujarat, Madhya Pradesh, and West Bengal. Therefore, currently, our challenge is to prevent spread from the high burden zones to low burden, prevent the spread from urban to rural, and make sure that we have a responsibility for the society. It's not the question, there are umpteen challenges, there are social pressures. When I look at the migrants struggling to even get food, our heart cries out. These are the challenges that we are meeting. However,
but some of these ships have already sailed. Professor Brahma Mukherjee, morning in Michigan. The reality is that migrants are moving en masse by road, by truck, by bus, by train, by whatever means they can find back. That heat map that I showed for India shows how the infection is spreading. People who are watching would like to know from you, ma'am, what should we be doing, Professor Mukherjee, to try and keep ourselves safe at a time when offices are asking many of us to come back to work, and yet you're worried about what the pandemic can do to you?
Thank you, Rahul, for having me, and good evening to all. So I think that this is a very critical situation right now, and when we mean that to keep us safe, I think we should take a holistic view of life, not just safe from coronavirus, but other non-COVID-19 related illnesses, mental health, psychosocial health, and the distribution of loss and suffering, human suffering, has not been evenly distributed across the society. So I think it is our job as society members to really go after and protect the vulnerable, and also really think about amalgamating and galvanizing the society in a spirit too, and take care of the poor and the socially marginalized groups. I also think that employers should really incentivize getting tested and come forward if you have symptoms, because if I am afraid of losing my daily livelihood and wages, why should I get tested? Why should I say that I was in contact with a case? So I think this social milieu and community participation and engagement is really critical at this point. And when we look at the national data, I think Dr. Babu has pointed very correctly that there is tremendous heterogeneity across states. We need to really recognize that. But at this point, I think we really need to, our focus should be reducing human loss and suffering in a holistic way. The virus is spreading, there is fear and anxiety, but there are other causes of death. We are doing so much research, even in US, what this delay in care, that people are afraid to go to seek their health care that they need, what this is causing on mortality and morbidity. I think we have had 2 months of lockdown. It is really important for us to take a complex systems, holistic point of view, to take care of ourselves and to take care of those around us.
But Professor Gautam Menon, people are watching have more bread and butter concerns. There's a big fight raging amongst all RWAs. You may have seen some of those. Should we allow maids back into their houses? Should the cleaning staff, the drivers, the security guards, many of whom have been sent away, should they be allowed back or not? Now, people have been, for example, in many houses taking care of their own daily chores, helping in, but now they're saying, okay, we've been doing this for 50 days. How long does this go on? How do you help wrap our heads around some of these concerns? What would you suggest, Professor Menon?
Thank you for having me on the show. And certainly with a disease that spreads like COVID-19, there are some standard precautions that you should not only take now during the lockdown period, but also after. And they include physical distancing, they include wiping surfaces that many people access, doorknobs, etc. They include wearing masks, and they include not being present in crowded places and to reduce crowding as far as possible. So within the constraints of that, I don't think one should call for a complete shutting down of all human and social interaction as a consequence of this. One should be sensible, and one should try to return to normal life, keeping these points in mind. Some work that we've done suggests that one way of getting people back to work might be to put them on a staggered schedule. Work for 3 days, then take 6 days off, go back for 3 days, and you have a third of the population coming back. That way you have smaller numbers at work so they can distance better, and they're under lockdown conditions when they're back at home. So there are ways of sending people back to work, of returning to some degree of normalcy, while keeping in mind the need to keep the epidemic under control. And as Professor Babu has said, we have been a success so far during the lockdown period. Doubling time for the increase in the number of cases has actually increased to now a number somewhere between 15 and 20 from a number that was initially between 3 and 5. So in that sense, we should build on that success, make sure that people understand the need to be responsible in their interactions, in their social interactions, in their physical interactions. With that, we can hope to keep the epidemic in check.
No, so with all respect to all three of these wonderful guests on the Newstrack, your first answers were helicopter shots taken from the sky. I want you to now zoom in and come to the ground. And Professor Mukherjee, I'm asking you very simple questions. People are wondering, can they allow the domestic staff to come back or not? Because for 14 days, how do you quarantine them? Where do you quarantine them? You have no idea where they've been the past 50 days. Have they been safe? Are they positive, negative? There isn't enough testing. So those are the kind of real daily issues people are grappling with. As experts in the field, can you try and give us some answers into those questions?
So first of all, I think that, the lockdown, if you think about the basic reproduction number, if you look at a population level, the lockdown has had some effect, because we cannot deny that the R was around 2.6, 2.5, and right now it is 1.3. So it has slowed down the spread of the virus, but it has actually, so human life is not just characterized by the spread of the virus. So there are daily issues. So I think that about allowing maids, this is a very tricky situation in terms of it's really personal decisions, and there are some costs, right? So there are some households which are able to manage the work, and some households there where the cost and benefit you have to weigh in. But some precautions, as Dr. Menon and Dr. Babu mentioned and has been reiterated over and over, about wearing masks, washing hands, and minimize the essential, like what is core essential and what can be redundant. So in terms of high areas of contact, for example, doorknobs, common toilets, these are the areas in a workplace, coffee machines, and things that everybody uses, because we know a lot more about the person to person and then person to object to person transmissions. So we really need to chart a plan which is maybe at a lower capacity, staggered schedule, but a gradual, modulated, resuming normalcy of our households and our workplaces. Particularly,
Dr. Babu, I realize that the question is tricky, but I want to press you further. It's not, you're saying gradual, modulated return to normalcy. That sounds very interesting and fancy when you put it like that, but 15 days later, the reality is that we'll have more cases, that the spread would be even more accentuated. And therefore, how do you gradually do something when there's more virus 15 days later, which you can't do right now? For example, going back to work. now companies are saying, many companies are saying, okay, we'll have employees back. Is that safe? How do employees try and keep themselves safe? Secondly, allowing people back into the house. Now that's, you're allowing someone in a very, very personal space. Is that, how do you try and deal with that kind of a situation? What would be your recommendations, Professor Babu?
Now, I think we have to make very practical recommendation. I hear you. And depending on the classification system that the ministry has recommended, the states are drawing in terms of which zones are containment zones, which zones are activities permitted. So under these scenarios, if the zone regulations permit that people can walk around freely, the maids can come to
one second. I want to press you because most of India is orange at this moment. Okay, if you're in a red zone, which is a containment area, then this question doesn't apply, and I don't even think people in those areas will be having these questions. But if you're in an orange zone, where it's not green, it's not red, it's somewhere in the middle, and there's a fight in your RW about whether you should allow maids or not allow maids, allow drivers, not allow drivers, how would you suggest people who are watching approach those questions? These are the questions which are of maximum relevance to most people watching.
So, if it is in green and orange, wearing masks and allowing people to move should be some most normalized situation, because wearing mask, whoever comes inside the apartment complex and even within the houses when people have entered from outside, it is going to prevent most of the infection spread. Number two, wash hands as many times as possible for the person who comes and also the people who are inside. So that is going to continue. We have to be obsessive about how many times we wash hands. There's no doubt about it. Third, in terms of physical distancing, whatever is possible in all these apartments or wherever, whether it's transport, whether it's office space, that has to be followed. So these are the practical things we will have to do, Rahul.
Gautam Menon, even if you allow somebody back in wearing a mask, now you don't know how safe that person has been, what their current status is. They're touching all kinds of objects. We know that by touching objects the disease can spread. Therefore, it's a real conundrum. Should people allow staff back in? Should they not allow staff back in? What, forget the larger picture just for the moment. For people who are watching on a very personal level, and why I'm asking this question to our guests is because that's the question that people are asking me. We need to go out now that we're allowed to drive. Should we have our drivers back? Or they're asking, for example, if their maid should come back. Many people now saying, okay, we've been doing all the household chore. Can we finally have staff back? How would you suggest they tackle that specific question, Gautam?
They should tackle it sensibly. After all, it is finally a personal decision. But remember that you can train someone, you can train yourself, you can train other people to be aware of where they have a situational awareness of where they are and how they move around in a house, to minimize the number of surfaces that they touch, to confine what they touch to a certain subset of items. This holds for you as well as it holds for anybody else in the house. And the other thing to do is to make sure that people who are elderly, people who have some sort of pre-existing health condition, are in a sense insulated from people who come from outside as far as possible. Wear masks, be aware of what you touch, be aware of what you contact. But beyond that, it should not be a sort of deep psychological problem of, should I do this and will I be permanently upset about having let my guard down at any point? There is a reasoned approach to this, and there is a certain amount of sense that has to go into these measures. If you are careful, as careful as you can be, you should have, in a sense, you will have minimized your possibility of risk. I should also point out that there should be no stigma associated with falling ill. This is a disease that spreads very rapidly. It's a respiratory disease. Some people will catch it, some people will not catch it. For a large fraction of the population, it will be a mild disease. For a small fraction of the population, especially those with some sort of pre-existing condition, it will have more severe complications. But this is something that could happen to absolutely anybody. It could happen in any possible way. There is no stigma associated, and there should be no stigma associated to having fallen ill with COVID-19.
I think the broad sum of what all three guests have said, A, it's a very personal decision. There is no yes or no answer to it, so you need to think this through. You've heard expert medical opinion, but ultimately take your own decision and try and make yourself, as all three guests pointed out, as safe as is possible, and ensure that any staff, any person you come in touch with is also following all the precautions that have been laid out. Professor Brahma Mukherjee, Dr. Giridhar Babu, Professor Gautam Menon for joining us on the Newstrack this Monday evening. Thank you very much. Thank you.
Hello everyone, this is Rahul Kanwal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.